Assalamu alaikum. Thank you for inviting me in this beautiful and educated organization conference. My name is Ahmed Alahmadi. I am intervention consultant in Medina Cardiac Center. This is my hospital, which I loved, and I'm proud to work in it. So I have this patient, is 48 years old, male, smoker, presented with the chest pain and rising troponin, and the diagnosis was non-STEMI. So angiogram showing this second diagonal, which is covering a good bare area. So the decision that time was to go ahead with the BCI. So wiring the second diagonal with the BMW was difficult because of wire prolapse. Next step was using a microcatheter. Then wire start to be advanced through the lesion. So all of a sudden, things come out. So this is what I'm seeing under fluoro. So this is the two catheters here, okay, because we didn't take this picture, but you see here, this is a loop, okay, of the guide wire in the ascending aorta. There is a two ends, one end is here, and the other one is in the diagonal. So this is me when I saw that picture, because it's first time for me I saw something like that. So 10 seconds, then I'm thinking also what is that? So I have approach in the complication. I'm asking myself, is the patient hemodynamically stable or not? Is there a new chest pain or a new symptom with the patient? The answer was no. So calling for help, as we have a senior consultant. So I called my senior consultant to be around. And differential diagnosis in my mind, anesthesia and surgeon were aware about what happened and ready for anything going wrong. So the differential diagnosis, this is what I'm using, okay? I like it, this is from Dr. Emmanuel. So I go with the approach. What is this? This is a cardiac coronary. So this is equipment loss. So having this is in my mind helped me in the differentiate and organize what's happening there and carry on. So it's a guide wire fracture. So what the causes of the guide wire fracture? So guide wire fracture causes can be aggressive pulling, guide wire over rotation, atherectomy over kinked wire. And entrapment can be gelling or deformation or withdrawal of the wire with the loop at the tip, body wire with the filter, severe calcification. All this is the causes of entrapment and fracture of the guide wire. So in my case, I believe this is what happened. It's a guide wire over rotation. So I use this approach, okay, also from the Dr. Emmanuel. So I'm thinking this is a guide wire fracture. What's next I will do? I need to remove the wire fragment. So we use to snare it. So me and my senior consultant there, it was in my beginning of my career. I think in the third month after I finished my fellowship. So this is what we are doing. This is just how it's work. So this is a gauze neck. We choose the end of the wire in the ascending aorta and trying to snare it and take it back. This is, this is the type of the snare we have in snare or gauze neck. The other one, microelite, I didn't see it before. So the step was to get a new axis, femoral axis, which I used, it was radial axis. So get a new axis. We used in snare through Judgkin right for French, snare the end of the guide wire, which looped in the ascending aorta, then imaging of the coronary after retrieving the wire. So as you see here, okay, the end of the wire is taken, and we snare it through the femoral artery, and that's wire in the radial, the guide in the radial with some microcatheter there. So after that, we take a picture and and do IFOS, and there is no remaining or lifting any fragments there, then we go ahead and wiring and stent the diagonal there. So you can name it, who is this? So this is my senior. This is me after I finish the case. This is a message, I like to raise it here for all our colleagues in my age and the beginning of my the career. Working in an institution, a news institution with an expert and seniors, consultants, it's a blessing for you and helping a lot in your career, and really it's a blessing. So one of the criteria to choose an institution to start, you have an expert consultants around you to guide you. So this is my message, how to prevent things, avoid over rotation, don't pull hard, no atherectomy over Guidewire. This is a nice